Ready?
We are live.
Hey guys, it's Nisha the PK over here at Dr. Emer's office, and today I am doing something called Venus Legacy on my beautiful patient. Now he is just 1 month post-op from his procedure, and I'll kind of do a little bit of a quick overview to remind you guys what he had done and kind of tell you what we're doing now and why. So, if you tuned into our live that we just did a few minutes ago, I kind of talked about the fact that he had a little bit of a problem area down below and a little bit on his flanks, a little bit of kind of he wanted more definition to that area. So we were able to achieve that by doing HD lipo, internal heating or renewing on, and then we also did a little bit of fat grafting to his calves to give him a little bit more definition to the area. Now, just 1 month post-op, he already looks amazing. You can see a lot of the definition to his abs. And, you know, particularly for this case, we wanted to make sure that we really give him that definition that he used to have all the time. Now, my client is in his early 30s, and so this is just kind of a little bit more of kind of rejuvenating his body. What I'm doing right now is the Venus Legacy, and I always recommend that you do the Venus Legacy and the True Sculpt Flex about 2 weeks post-op from your procedure. You can start as early as 2 weeks. It's fine if you wait a little bit longer, but you can start as early as 2 weeks to do the Venus Legacy and the True Sculpt Flex. I know I always talk about it, but I never really have a chance to show you guys some of these body treatments that we do after we do surgery to kind of help to enhance our client's results. Now with the Venus Legacy, this is about 15-minute sessions on each problem area. And what we're doing right now is we're doing radiofrequency energy to the area, and this is going to help to further decrease swelling and tighten the area after surgery. Now we always recommend that you do this in addition to something called True Sculpt Flex. You guys will be able to see me do True Sculpt Flex in just a little bit, but True Sculpt Flex is essentially an ab workout, and so together I like to effectively call them to tone and to tighten. This, a part of that tone and tighten, the radio frequency, this is the tightening part, and then the True Sculpt Flex, which is a 45-minute ab workout, will be the toning part. You can do this in a series of 3 to start out with, 1 to 2 times a week. The first few sessions I recommend you do within a week, and then you can space it out over the next 2 to 3 weeks. So this, what he feels right now, or what you should feel, is just a little bit of warmth. A lot of my clients describe this really as like a hot stone massage. It's not uncomfortable at all. It's actually super relaxing, and so they get to kind of sit and kind of enjoy it, but it has a big purpose. It's really working to further tighten this area and to further make sure that any swelling that he has will be decreased. Now, I remind you, to really see his full results, you have to wait really about 6 months to a year. You'll see how great he looks then, but even now, 1 month post-op, he looks amazing. A big part of that is, of course, because he was able to do the HD lipo, the internal heating with Renuvion, but also aftercare is super important. So that 10 to 14 days after your surgery, you really want to make sure you're doing your appropriate aftercare with the IV therapy, the lymphatic massage to help express excess fluid, and then you also want to do your hyperbaric oxygen therapy, which will further help to kind of help your healing process and make sure you're healing really, really well. Then at 2 weeks, you want to go ahead and do your Venus Legacy and your True Sculpt Flex. And then at 3 weeks, we recommend you do your treatments for your lasers to really help to minimize your scars. Now he's already healing really, really well, but we're going to do a little bit of lasers after this to minimize his scars. So not only does he look great, but the scars that he has from his procedure is going to be really, really minimal.
All right, we have someone saying that he looks fantastic.
He looks amazing. I mean, look at this. I'm going to take a little break, but look at his ab definition already. You can see he's well sculpted on either side. And you guys can't feel it, but he's very, very tight here. So Renuvion is really working to tighten the area and make sure that area is nice and shrink wrapped after doing the HD lipo.
How long do you recommend after lipo to start working out?
So we always recommend that you can start working out at about 3 weeks post-procedure. A part of that is, like, a lot of clients will ask, well, what can I do? Well, you can do pretty much cardio. You can do a little bit of lifting. As long as you don't have any pain when you're working out, you're fine. So about 3 weeks post-op, you can actually start working out. Perfect time to start working out, actually. So once again, this is the Venus Legacy. This is the radio frequency that's producing heat, and this is going to help to further decrease swelling and to tighten the area. This is not painful at all. Most of my clients will literally fall asleep while I'm doing this because it's very, very relaxing. I like to combine the Venus Legacy with True Sculpt Flex. And True Sculpt Flex is like an ab workout, and it's really going to help work to tone the area. True Sculpt Flex itself as well, it's not a very uncomfortable procedure, but you do feel the machine working to tone the area. And I always recommend you do this in a set of 3. You can start by doing 1 to 2 sessions in that first week and then do it every week afterwards. Remember, it's a workout. The more you do, the better you see the results. And this is 1 month post-op, guys. He looks amazing. We didn't do anything to the chest. He already had a very nice, well-defined chest. We were just able to further sculpt out his abs and kind of help everything to look very kind of nice and well-defined. You can also do Venus Legacy to other areas of your body. You can do this to the buttocks. You can do this to the posterior thighs and the middle of your thighs. You can use Flex on your posterior buttocks and posterior thighs as well. So this is really a great treatment to really help to tone and tighten the area after surgery, but just in general as well. It's a great additive treatment. Even if you're already fit and you work out, this is a really great procedure to kind of add to your routine.
All right, Nisha the PA, thank you.
All right, guys, it's Nisha the PA, Dr. Emer's office. I will talk to you guys next time when we're doing the True Sculpt Flex. Bye, guys.